Well, good afternoon, everybody. Thanks for being here. We are, whoop, guess we're not already. I can't be sure that's not going to fall. Well, thanks for being here, everybody. We are here today to announce that as of today, as of now, I am terminating the citywide indoor mask mandate for the city of Hartford. I think it's important to keep a number of things in mind. First of all, we have said from the very beginning that we would follow the data, that we would respond to the trends that we see. As you know, we did not have a mask mandate over the summer. We imposed citywide indoor mask mandate in mid-August when we began to see that Delta variant surge. And we saw cases rise quite significantly during the late August and September period. Over the last 4 weeks, as we have tracked this data carefully, we have seen those numbers remain stable. And they are about half of the positivity rate, the test positivity rate, and the case rate that we saw when we imposed this mandate back in August. So we believe that it's responsible. I believe that it's responsible action today to remove that mandate. I want to stress that companies, employers, anybody else can still require that masks be worn in their spaces. Of course, any individual can wear a mask when they feel comfortable doing so. Speaking personally, I will probably keep a mask on a lot of the time if I'm indoors, particularly if I'm indoors and around folks that I don't know or in crowded public places. But I think it's important that as a community, we respond to the data and the trends in both directions, and that it doesn't become a one-way ratchet where when we see numbers go up, we impose restrictions, but then don't adjust those restrictions when we see a stabilization or a decline. So given the numbers that we've seen, again, stable numbers for over a month at about half the rate that we had when we imposed the mask mandate. We think that this is the right thing to do at this moment. I also want to stress that it's entirely possible, should we see another surge, that we would impose a mandate again. I think the best way to deal with this pandemic and to deal with the coronavirus, which is going to be with us for the foreseeable future, is to adjust as situations change. And that's what we've done throughout. That's what we're doing today. I'd be happy to take any questions.
Is there anything you look at more than others? I mean, hospitalizations, deaths, just cases overall, or is it just kind of mixed?
We look at all those things, and overall, you have seen both hospitalizations and fatalities remain quite a bit lower than they were earlier in the pandemic. Thankfully, there have been tremendously important advances in healthcare and treatment of the coronavirus. And of course, vaccines are now widely available, and we urge everybody who is not yet vaccinated to get vaccinated as quickly as possible. And if you've got kids, to make sure your kids get vaccinated. I've got 3 kids, 12, 10, and 8. Our 12-year-old got vaccinated the first day she could, and our little 2 got their first dose this past weekend. And I can tell you they felt an enormous sense of relief, and as parents, we felt an enormous sense of relief that they've got that protection and the peace of mind that comes with it. Again, want to stress, we look at all of the data. We look at the test positivity rate, we look at the case rate, that's the number of cases per 100,000. We look at hospitalization trends, and of course we look at fatalities.
So children in kindergarten, pre-K programs and that can't get a shot yet. They can't go to a public school. They don't have to wear masks.
Well, I believe that masks are required in nearly all of those child care settings.
So you'll continue to abide by the state policy?
Absolutely. Let me be clear. Well, let me be clear about a couple things. What I am terminating today is the executive order that I imposed in the city of Hartford that goes above and beyond what was required by the governor's executive order. The governor's executive order still requires people who are not yet vaccinated to wear masks indoors. That order remains in effect. in mid-August in the city of Hartford, we went above and beyond that. We said everybody's got to wear masks anytime you're indoors. We did that in response to the surge that we were beginning to see. We saw a significant surge, and we have since seen a significant stabilization and decline. And we're responding to that data. We are responding, we believe, responsibly. And we're going to continue to keep a close eye on that, and we will always do what we think is the best thing to do for the sake of our city, and that is balancing all considerations.
You mentioned the vaccinations for children aged 5 to 11. Is that part of what makes you comfortable making this decision and sending the executive order?
Look, I think, first of all, remember that we're quite a few weeks away from even the first 5 to 11-year-olds being fully vaccinated. And I'm conscious of that as a father of 2 5 to 11-year-olds. But I think what way I would answer that is to go back to where I started, which is we didn't have a mask mandate for most of the summer. We imposed that mask mandate in August when the case rate and the positivity rate were twice what they are today. So I'm not sure that that development necessarily affects our decision today, but it is enormously comforting, and it's a hugely important step forward that 5 to 11-year-olds can now get that vaccine. And as you know, the mask mandate remains in place for schools. I think that is absolutely appropriate.
Speaking of the CDC giving authorizations for vaccines, they still look at Hartford County as substantial transmission, and for those counties still recommending that masks be worn indoors. What about the data that makes you feel comfortable, or does that classification give you any reticence?
Look, what I would say again is a couple of things. One, employers, property owners, families can still make their decisions about whether they want to have a mask mandate. I will say that here in City Hall, for city facilities, we still have a requirement that in public spaces and for those public interactions, you got to wear a mask. We may take another look at that. We may change that, but at this point, that remains in place in city facilities. Similarly, any employer, any retailer can make that same decision with respect to their spaces. And any individual can and should feel absolutely comfortable wearing that mask anywhere they want to. And as I said at the start, I suspect I'll be wearing my mask quite often.
And then just one more thing. If we go back before we knew about the Delta variant, it was right about this time last year we saw that second wave, right around the holiday season, the 4
Yeah.
months.
It's an important question.
Right, so in the wake of this, is there anything you'd like to remind people about?
Yeah, so a couple things. The question is about the coming holidays and the fact that last year after the holidays we saw a surge. We'll have probably a number of press conferences in which we urge everyone to be careful. But I want to stress, the most important way you can be careful today is to get your vaccines. Get fully protected, and then if you can, get your booster shot. And before those family gatherings, get yourself tested. But I think if we're being honest with ourselves, most family gatherings, people are not going to be sitting around with their masks on. And so I don't know that this order today or this decision today affects the likely results from holiday time. But there are absolutely things people can and should do going into the holidays and during the holidays to protect their families and protect the community. The most important thing is to get vaccinated, get fully vaccinated, get your kids vaccinated, and then if you can, get tested before you're gathering in large numbers with those you love.
And just to, one more time, if you were working in a city building, in Hartford, you still wear a mask?
Again, in the public spaces. So if folks are sitting in their offices, in most cases with sufficient distance, they don't need to. With, again, the caveat that is not my decision to make, but I think is the right one, that the governor's executive order still requires anybody who's not vaccinated to wear a mask indoors. One more reason to get vaccinated. The most important reason to get vaccinated is because it'll keep you out of the hospital and dramatically reduce your chance of dying.
We talk so much about health risks, right, when it comes to masks and vaccines, but maybe on a more positive note, do you have any sense of impact for local businesses, restaurants? Will this make people more comfortable and
I hope so. I mean, look, it's hard to measure what that impact will be. If at the margin, it makes some of our employers more likely to bring their employees back sooner, or if it means people, will more readily decide to go to that restaurant in Hartford, then that's welcome. But we're not making the decision for that reason. We're making the decision because we think that we can responsibly remove this restriction that we've imposed. And again, I want to go back to what I said before. I think it's important that we use the tools that we have, and we use those tools in response to the trends that we see. But we shouldn't let our public health measures become a one-way ratchet, where you always ratchet them up, but you don't bring them back down even when the facts and the circumstances change. We are fully prepared to ratchet back up. We will not hesitate to ratchet those restrictions back up if we think that the public health demands it. But we believe, given the numbers that we're seeing right now, we can responsibly remove this restriction and ask everybody to use their best judgment and urge everybody, no matter what else, to get vaccinated.
Mayor, quick unrelated question. City council is looking at red light cameras. What are your thoughts on cameras in the city and how strict should any consequences of it be?
Well, I mean, it's important to know, currently Connecticut, let me just say for those who couldn't hear, the question is about red light cameras. City Council introduced and is considering a resolution to support a pilot program for red light cameras. Current state law does not allow cities or towns to use red light cameras or speed cameras. I will tell you, I've heard from a lot of residents who would like to have red light cameras or speed cameras. And so if the city council decides that they're going to pass the ordinance, the resolution that they're considering today, then I would look forward to working with them to advocate for it on behalf of our community. Any other questions? All right. Liani, anything you'd like to add, our health director?